Hello everyone, welcome back to our channel Learn Medicine by Dr. Nikita. So in today's lecture, we'll be discussing more about the drug salbutamol. In the previous lectures, we have discussed about the mechanism of action of the drug. First of all, just to mention, this drug is also called as albuterol and Ventolin, right? So these are the two names by which this drug is also known as. Usually salbutamol is given as an aerosol or as an inhaler. It can also be given orally. The main disadvantage about giving the drug orally is that it takes longer hours to show its action, and the bioavailability is decreased because 50% of the drug is exhausted by the first pass metabolism. So it is only 50% effective. Only 50% of the drug reaches the target site, whereas in case of aerosol or inhalers, the drug reaches the target site in a very short duration of time, but also the action lasts for a very small duration, right? So this is categorized as SABA, or a short acting beta agonist. So salbutamol is a short acting beta agonist. Salbutamol, this is responsible for bronchodilation, and it is targeting the bronchial smooth muscles. Where is it showing the action? It is targeting the bronchial smooth muscles, right? One thing about salbutamol is that as it shows a rapid onset of action, it usually starts to show its action in it usually starts to show its action in 5 minutes when it is given as an inhalation or an aerosol, and usually its duration of action lasts for 2 to 4 hours, right? But there is one difference. When this is all is happening when you are administering the drug via inhaler or an aerosol, whereas if you're giving the drug orally, the duration of action will be 4 to 6 hours. This is how much time the drug will be there in the body and will try to show its actions. Whereas on the contrary, when it is given as an inhaler or an aerosol, it starts its action very quickly, and similarly the action dissipates also very quickly, right? So it is a short acting beta agonist. Now I'm rubbing this off and we'll learn more things about salbutamol. So what are the contraindications? What are the side effects? Where is it used? Salbutamol is a drug which is given when a person is suffering from. So what are the indication when you use the drug? So when do you prescribe salbutamol? When a person is suffering from a condition of bronchial asthma, where they are showing some kind of a wheezing sound when they are breathing, right? When they are breathing, there is kind of a wheezing sound. There is obstructive breathing. There is an obstructive breathing. So these are the cases where salbutamol is given. And now also let's learn about the receptors. Where is it acting? So salbutamol is a drug which is sympathomimetic in nature. So it is mimicking the sympathetic action, right? We all know the sympathetic action. The heart rate was being triggered and all those conditions. So salbutamol is a sympathomimetic drug. It mimics the sympathetic action and is a beta. I'll say it targets the adrenergic receptors. It is targeting the adrenergic receptor. So we have 3 adrenergic sites: beta 1, alpha 1, beta 1 and beta 2, right? When any drug is acting on the alpha 1 side, it causes vasoconstriction. What is vasoconstriction? Basically a constriction in the blood vessels, right? And the constriction of the blood vessels. Here we are talking about the circulatory system. So if you want to know more detail about that, just quickly check all my circulatory system videos and you'll have a better idea what is vasoconstriction. Then if a drug is targeting the beta 1 receptor, it leads to, it is affecting the chronotropy. So chronotropy is basically the heart rate. If I say any drug is positive, is showing positive chronotropic action, that means the heart rate is increasing. If I'm saying a drug is causing negative chronotropic action, that means the drug is decrease. That drug is responsible for decrease in the heart rate. So chronotropy and dromotropy. Dromotropy is basically the atrioventricular conduction in the AV node. So when the conduction in the AV node is affected, that is called as dromotropy. So if a drug is increasing, is causing a positive dromotropic action, that means that drug is responsible for increasing the conduction in the AV node. When the heartbeat was generating, the atria and ventricles were contracting and relaxing in that part. When the AV conduction is stimulated, then it is called as positive dromotropy. So basically, salbutamol is responsible for targeting the beta 2, which causes bronchodilation of the smooth muscles. Bronchodilation of the smooth muscles. So these smooth muscles are located in the, we are talking about the smooth muscles in the alveoli sac, in the respiratory system. So this is the target action. The drug is targeting the beta 2 receptor, but since the drug is sympathomimetic in nature, since the drug is targeting the adrenergic receptor, it does have potential effects on triggering or stimulating or activating or binding with the alpha 1 and beta 1 receptor also. That is, it leads to vasoconstriction, positive chronotropy, positive dromotropy, positive conduction, right? So that is why salbutamol is contraindicated. Contraindicated. That is, you should not administer salbutamol to a patient who is suffering from ischemia or hypertension or any kind of a any kind of a heart disorder where the palpitation is high, or if a person is being administered digitalis. So we have to keep that in mind. If a person is having any of these conditions, we should not administer salbutamol, which is albuterol or Ventolin. Why? Because salbutamol is sympathomimetic in nature and will be responsible. So what are the effects? Salbutamol will be responsible for mimicking the sympathetic action, that is triggering the heart conduction. Okay, let's learn about the side effects of the drug. So the side effects of the drug are muscle cramps, hypertension. As we all know that this drug is targeting the alpha 1 and beta 1 receptors also. So the side effects will be inclusive of the effects on heart. It causes dry throat, dry mouth, dry nose. So these kind of an effect. This is also targeting okay, this is also responsible for tachycardia because it is increasing the heart rate, right? Now let's learn about the doses or the drug, in which amount should salbutamol be administered. That is a very important question. So either it should be given as an aerosol, or it should be given as an inhaler, or the drug should be given orally, right? So if the drug is given orally, 50% of the drug is exhausted by first pass metabolism. The duration of action is 4 to 6 hours. Whereas when it is given as a meter dose inhaler, right, the drug is 400 to 600 microgram, which is usually 4 to 6 puffs of the drug, right? And when you are given as giving the drug in the form of an aerosol with the help of a nebulizer, then the drug is administered as something 5 microgram, right? You must have heard of the drug, a common brand name called as asthalin, right? So this drug is utilized for a quick treatment. This is a quick treatment basically. And if I say somebody is suffering from an asthmatic attack, in that case salbutamol must be administered right away. but you cannot use this drug as a prophylactic treatment round the clock. That you cannot always give salbutamol because it has numerous side effects. It is targeting the heart, it is increasing the palpitation, the anxiety, the heart rate conduction, the AV conduction, all of these things it is stimulating. So this should only be given to control the asthmatic attacks. Whenever there is an asthmatic attack, in that case salbutamol should be administered, but it should not be used as a round the clock prophylaxis, right? It is not a round the clock drug. In that case there are other treatment options where you can slowly treat away the disease, but this drug. Okay, thank you all for this now. I think so we've covered all the topics, and in future lectures also we'll be discussing, we'll take some topic, we'll discuss the anatomy, the physiology, the prototype drug, its mechanism of action, the side effects, the pharmacokinetics, the pharmacodynamics, all these things we'll try to cover up. So do drop the topics in the comment section. And Learn Medicine by Dr. Nikita is now on all social media platforms. We are on YouTube, our main channel. Then we are on Instagram, on Facebook, and also on LinkedIn. So I've started dropping notes of some topics on Instagram and Facebook. So we are a family of 1.65K. So I'm happy for that, and we are growing every day. So once we reach 5K, then I think so we can start documenting more of a sequence kind of a notes according to your syllabus, like unit wise. That is how we can go. So until then, keep following us, like, share, and subscribe. Thank you.